You know, leg disease is a common problem and it can come from your veins. Our next guest is going to help you get back to normal every day. We have Dr. Charles Moak here from Allure Medical. Dr. Moak, thanks for joining us today.
Thank you, Megan.
I said before we came on, I was like, I hear your commercials and see them all the time, but explain exactly what Allure Medical is.
Okay, so we look at this from a treat the problem or cure the problem standpoint. Typically, when people have varicose veins, they might never get worse. They might just have some ugly-looking veins. But some people, about 4% of the population, will get worse and worse. They'll get discoloration, they'll get swelling, and they think they need to be on a water pill, and maybe eventually they get a sore. And what's happened traditionally is we've treated those with bandages and compression and different things. But there's actually a cure, and it's true the same thing that we use to treat the varicose veins. So we reroute the circulation and fix the circulation.
Is there pain with the beginnings of varicose veins? Is there discomfort or just a visual thing?
Yeah, that's a great question. So once you start getting pain, it's going to get worse at 4% per year. So if you get pain, it's going to keep getting worse. That's when it's time to really address it. Prior to pain, there's no medical reason to have to treat them. But when somebody has a visible varicose vein, they have swelling or pain or heaviness or restless legs at night or blotchiness or redness, now you really got to realize you've got a problem with your circulation.
What causes varicose veins?
So varicose veins are caused by a problem with the valves in our circulation. So when our heart beats, it pushes our blood to our feet and our arms. That's our blood pressure and our pulse. And the blood's got to get back to your heart somehow. And it goes through a series of one-way valves, and the muscles squeeze it back up. So our calf muscle to our thigh muscle to our abdominal muscles. But the veins in your skin, they don't have any muscle around them, so they rely 100% on the valves. And for some reason, some people, the valves just fail, and the blood sits there. Our body responds by trying to grow more veins.
Wow, because I heard like back in the day, oh, if you wear high heels, you're going to get veins. Like, you know,
it's probably more
like
genetic than anything. That's, I mean, if both your parents had them, there's like a 95% chance you will. If one parent had them, it's like 50%. In the general population, probably about 25%.
Well, you're making it easy for us to find you and you know, have that consult. You're not just in Greenville anymore.
Yeah, we're in Simpsonville, Spartanburg, Anderson, Hendersonville, and Asheville.
Okay. We don't
You're
need
hitting
a
all the
referral.
bills.
We can just
make
an appointment with you directly.
Yeah, we do like a free screening. We can come in, we can just take a look and see if your leg, you know, if you have heavy legs or painful legs, is it related to your circulation? And we can tell that on an exam, and then if it looks like there's a problem, we do an ultrasound and diagnose it.
And then once you start doing the treatment, what kind of treatment are you doing? And is this something that insurance covers?
Yeah, great question. So what happens, we get an ultrasound, which is a way to look through the skin, kind of like what you do to look for babies and a pregnant mother.
Right.
And it gives us a three-dimensional roadmap of what's wrong with the veins. Then we identify the ones that are problematic, and we use a device that's kind of like a laser to basically, it cauterizes it. Doesn't hurt, something that, you know, you get maybe a little shot, but that's it. You don't need to be knocked out, there's no sedation, and you're immediately active afterwards. The insurance covers it the vast majority of the time, particularly if they're symptomatic. If you're having heaviness or swelling or aching, it's
private insurance, Medicare?
Even Medicare.
Work with Medicare too?
Yes.
So it's virtually painless, what you do to people that
virtually
have these
painless.
problems.
Yeah.
That's marvelous.
I love it. And you're going to be doing some events maybe coming up? Do you have any? Or if people are looking for events, can they go to your website?
They go on our website, and we always offer free screening exams, so they can come in and see us. And when we have events, we post them on our website.
Okay, because I bet the free screening, they're probably like, okay, yes, I want to get this taken care of. Because I think it's important what you said. If you feel pain, don't think, oh, it'll just go away. That's like, all right, it's kind of time to really start taking this thing into consideration.
You know, it does get worse every year, and it doesn't really matter at what point you get them treated, but the reality is there's a way to permanently fix this, to cure it, to cure the circulation problem. And instead of just suffering it worse and worse, we do like to see people a little bit earlier, but in any phase it can be treated.
Okay, very good.
So there you go. Now y'all know. You don't have to live with that and be in all that pain. Go visit our friends at Allure Medical. They'll take good care of you.
Thank you very much.
Thank you. Very good.
Thanks, Doc. It looks like a banker dressed in that suit. He was a banker when he walked in.
I want to do the drums now.
I know, right? Next time you get to do it.
Okay, hey, listen.